Hi everyone, I'm Dr. Oli from a medical officer from Wildlife Hospital, and I'll be discussing on the topic ovarian cysts. Now, what's ovarian cyst? Ovarian cyst is a sac filled with semi-liquid and materials in the ovaries. Now, most women, when they tend to find out that they have ovarian cysts, they tend to have this anxiety that, oh, this is going to be cancerous. Calm down. Most times, it's most likely be benign lesions. So don't rush and think about the worst. Now, how did you know you had to have ovarian cysts? Most ovarian cysts are being found incidentally, maybe through a pelvic examination or just an ultrasound that you just went for. A different ultrasound for a different diagnosis entirely, and it was just incidentally found. And those type of cysts are asymptomatic. You might not feel the symptoms and they just go away. Why? That the symptomatic ones are, what do you tend to feel? Pain or discomfort at the lower abdomen. You can also feel fever. You can have fever rather, what we call hyperparesia. It can be caused by ovarian cysts as well as discomfort, also abdominal fullness. You can even have bloatedness. You can also have indigestion, heartburn. So this is what ovarian cysts. These are like symptoms of what ovarian cysts can cause. There's even one that we can call wedge torsion that can rupture the ovaries, and you might, if not taken to the hospital immediately, might lose an ovary. So you should take ovarian cysts serious. Now, ovarian cysts can also be seen in postmenopausal women who are postmenopausal women who are no longer seeing their menses, women above 50 age. Now, when they have this ovarian cyst, we tend to find it worrisome because if there's an increase in this cancer marker we call CA125, then we should be thinking about ovarian tumors. Now, how do we get to find out about this? We want to do a transvaginal ultrasound as well as serum biomarker testing. This helps us find if there is an increase in CA125. Now, if in a postmenopausal woman there is the CA125 is normal, of course, we want to do a series of ultrasounds to know when this ovarian cyst progresses. Normal treatment for it, most times it goes on its own. But we also have surgical treatments where it becomes worrisome, when it's painful, when there is torsion. You want to do either a laparotomy or a laparoscopy. Now, a laparotomy is an open surgery. You want to it's like an open surgery, while a laparoscopy is like a minimal invasive surgery where you don't need to open up the patient. You just like take tiny holes and you drain out the fluid. This helps reduce the torsion and also reduce the pain. Now, for postmenopausal women who have series of these ovarian cysts, you want to advise for bilateral oophorectomy, which means removal of both ovaries, or as well to have hysterectomy, removal of the womb so it doesn't progress to cancer. So, in summary, ovarian cysts can either be treated or just left alone to regress. But if it's not coming down, oral contraceptive can work. And in a situation where oral contraceptive is not doing the job, then go straight to the surgery, which I just spoke about. I hope you're well informed about ovarian cysts. If you have questions, then drop it down in the comment section. If you have symptoms, feel free to walk in for consultation. Thank you.